My name is Professor Leonard Funk. I'm a consultant shoulder and upper limb surgeon and professor of orthopedics and sports medicine. I'll be talking about rotator cuff tears. The rotator cuff, as you see in the picture here, is a series of muscles and tendons that surround the main shoulder joint and provide stability and movement to the shoulder joint. At the top, you see the supraspinatus tendon attaching here. In the front, the subscapularis tendon. And as we go around the back, the infraspinatus tendon and teres minor. These are the tendons that make up the rotator cuff. Their role is very important in initiating and helping movement of the shoulder through its range of movement, both out to the side and in rotation to get your arm behind your back and in front of you. Rotator cuff tears are of two types. They're either a traumatic tear, which follow an injury, such as a fall on your shoulder or a wrenching injury out to the side, and these are traumatic rotator cuff tears. You can also get degenerative type tears, which are a natural part of the aging process where the tendon degenerates, a bit like arthritis of the rotator cuff. And then you get many in between, such as a degenerating rotator cuff, which then has a minor injury on it, and that then causes a tear. Here we're looking into the shoulder joint. The person is facing me, and you can see in the middle here a tear in the supraspinatus, which is the rotator cuff tear. Rotator cuff tears can often be diagnosed by your clinician by assessing your shoulder function, both for pain and weakness, which are the typical presenting complaints after an injury or fall. Ultrasound scan is extremely useful. This shows up the rotator cuff very well, and some clinicians can do an ultrasound scan in clinic for you there and then. MRI scans show detail of both the rotator cuff tear and the muscle quality, which is important to surgeons in considering the repairability of very large tears. Non-operative treatment of rotator cuff tears is generally for those degenerate tears in older patients that don't have a high functional demand. A typical program is known as the deltoid rehab program to try and build up the muscles surrounding the tear to compensate for that torn area to regain the strength of the shoulder back again. Should physiotherapy and painkillers not work, and for traumatic tears in the younger person, surgery is required. And this is in the form of a rotator cuff repair. This can be done either via open surgery, which is a larger incision, or by keyhole arthroscopic surgery. A general anesthetic or a regional anesthetic is used where the shoulder itself is just made numb. This is generally performed as a day case operation, and the torn tendon is closed up and fixed back down to the bone. Here you see a repair of the rotator cuff where you see the sutures and the suture anchors in place showing a repaired tendon. This is the anchor within the bone that goes into the bone, and the sutures are attached to it and they pass through the tendon of the rotator cuff. After the surgery, you'll be given a sling, which you should wear for approximately 3 to 6 weeks, depending on surgeon preference and the type of tear you've had. You'll need painkillers and you'll need regular physiotherapy to get the shoulder moving. It does take time to fully recover from the surgery, and you need to be a little bit patient with it. As with all operations, there are risks and implications and complications which your consultant surgeon will discuss in detail with you, prior to the surgery. For more information, please go to the website shoulderdoc.co.uk, have a look under the patient information section, and under shoulder look at rotator cuff, or click on the link below.